As you approach the end of your pregnancy, recognizing the signs of labor is crucial for knowing when it's time to head to the hospital. Labor can start gradually or suddenly, and every woman's experience is unique. Here's a guide to help you identify the signs of labor and determine when it's time to go to the hospital. Signs of labor. Regular contractions. What they are. Contractions are the tightening and relaxing of the uterine muscles, which help push the baby down the birth canal. Early in labor, contractions may feel like menstrual cramps or a dull backache. When to go to the hospital. Contractions that become regular, stronger, longer, and closer together are a key sign of labor. A common rule of thumb is the 5-1-1 rule. Head to the hospital when contractions are 5 minutes apart, lasting 1 minute each, and have been consistent for 1 hour. However, if you live far from the hospital or have had a fast previous labor, you may want to go sooner. Water breaking, rupture of membranes. What it is. The amniotic sac, which surrounds and protects the baby, can rupture before or during labor. This is commonly referred to as your water breaking. The fluid may gush out or leak slowly. When to go to the hospital. If your water breaks, note the time, color, and odor of the fluid, and contact your healthcare provider. You should go to the hospital if your water breaks, even if contractions haven't started, as there is an increased risk of infection. Immediate care is necessary if the fluid is greenish or brownish, as this could indicate the baby has passed meconium, the first stool, in the womb. Bloody show. What it is. The bloody show refers to the discharge of the mucus plug, which seals the cervix during pregnancy. This can happen as the cervix begins to dilate and thin out. The mucus may be clear, pink, or slightly bloody. When to go to the hospital. The bloody show is a sign that labor may be approaching, but it doesn't necessarily mean you need to rush to the hospital. If you experience heavy bleeding similar to a period, contact your healthcare provider immediately, as this could indicate a complication. Increased pelvic pressure. What it is. As the baby moves lower into the pelvis, you may feel increased pressure in the pelvic area. This is known as lightning or the baby dropping. When to go to the hospital. This sensation is common in the weeks leading up to labor, especially for first-time mothers. While it doesn't mean labor is imminent, it's a sign that your body is getting ready. However, if the pressure is accompanied by regular contractions, it may be time to head to the hospital. Lower back pain. What it is. Persistent lower back pain, often referred to as back labor, can be a sign of labor, especially if it comes and goes with contractions. When to go to the hospital. If you experience constant or rhythmic lower back pain along with other signs of labor, it's time to go to the hospital. Diarrhea or nausea. What it is. Hormonal changes that prepare your body for labor can sometimes cause diarrhea, nausea, or vomiting. When to go to the hospital. While these symptoms alone don't indicate active labor, if they're accompanied by other signs like regular contractions or water breaking, it's time to head to the hospital. Cervical dilation and effacement. What it is. Effacement refers to the thinning of the cervix, and dilation is the opening of the cervix. Your healthcare provider will check for these during prenatal visits or when you arrive at the hospital. When to go to the hospital. Your cervix needs to be fully dilated, 10 centimeters, for delivery. Significant dilation and effacement, especially if accompanied by strong contractions, are signs that labor is progressing. When to go to the hospital. Key guidelines. Follow your healthcare provider's instructions. Your provider will give you specific instructions based on your individual circumstances, including when to go to the hospital. Listen to your body. If you feel like something is happening and you're unsure, it's better to go to the hospital or call your healthcare provider for advice. High-risk pregnancies. If you have a high-risk pregnancy, such as multiples, preeclampsia, or a history of preterm labor, you may be advised to go to the hospital earlier or under specific conditions. Other reasons to go to the hospital immediately. Heavy bleeding. Any significant bleeding, especially if it's bright red or similar to a menstrual period, could indicate a complication such as placental abruption. Decreased fetal movement. If you notice a significant decrease in your baby's movements, It's important to seek medical attention promptly. Severe headache, vision changes, or upper abdominal pain. These can be signs of preeclampsia, a serious condition that requires immediate medical attention. Conclusion: understanding the signs of labor and knowing when to go to the hospital can help ensure a smoother and safer delivery process. Trust your instincts, stay in close contact with your healthcare provider, and don't hesitate to seek medical advice if you're unsure. Labor is a highly individual experience, and having a clear plan and support system in place will help you feel more confident and prepared as you approach your baby's arrival.